We've had some of the state legislative leaders here and others, and one of the things that I appreciate Kevin mentioned earlier, we've done very well in certain areas we cover in the state that are taking a lot of effort over the years to make sure they receive coverage. One of the concerns I have as we go forward in this is there'll be an effort to pare back, and we'll find that things that we have approved of in our own state are going to be lost in a national plan. And I just want to tell you, Kevin graciously mentioned the mental health parity bill, which I worked so hard on to make sure we were not going to be disadvantaged because we had taken a lead on an issue that years ago should have been addressed in this country. And I want to make sure as we go forward with the National Health Care Plan, we don't disadvantage our state, in a sense, by having to lose some of the benefits we've worked hard to provide coverage for the people in our state. Second, we stovepipe these issues too often in the past. We kind of look at them as separate issues rather than totality of them. One of the problems on this prevention, which we'll hold a whole day on just prevention discussions as well, is just learning some of the following statistics. Only 6% of our elementary schools in this country require any kind of PT. Only 8% of our high schools do anymore. You go to many schools in this country, across the state I presume, although I think we banned some of it, Don, where you have vending machines and junk food available every day. We have an epidemic of obesity beginning to occur with our children. Those problems are going to emerge as chronic illnesses in these people that will be lifelong problems, beginning in childhood. So when we talk about health care and insurance companies and policies, there are other issues that also are going to affect the outcome of a health care policy in this country that aren't directly related to insurance companies or doctors and the like that we need to address as well if we're truly going to bend that arc of cost. There's going to be initial costs in this that are going to make this more expensive. There's no other way to avoid it, just the investments in information technology. We lose 90 to 100,000 people a year die in the United States because of avoidable and preventable accidents and injuries that occur in the medical field. 90 to 100,000 people die because we don't have the kind of information that we ought to have available to make sure there's a duplication or other problems associated with it. So in looking at this, the totality of it, it needs a broad reach to get our arms around it. From the children early on, early childhood investments, as well as these other questions that arise. So I appreciate you mentioning this about how we can reduce the kind of cost and having truly a health care, a wellness system, not just a sickness system, which is what we're trying to talk about earlier.
Senator, I'm sorry, we're getting very close to being out of time. And
John, do you want to make a comment on this?
I know that there are an awful lot of hands up, and I know the senator has acknowledged his staff that is here. I also want to acknowledge my staff. Lisa Perrone, who's in the back there. Lisa, would you stand up?